for a second about the oversight process, not because it should be viewed as a wonderful way to just play obstructionist guerrilla warfare politics. I mean, I don't think that's the right way to think about it. One of the most important things about this bill was actually made quite clear by Speaker Nancy Pelosi when she said, you know, we have to pass this so we know what's in it. The American people still do not know everything that is in this bill. And the oversight process is one of the great tools of education that is available in explaining to the American people the exact nature of what is now the law of the land in the United States. What processes have been put in place, how many new agencies will be in CMS and in HHS in general, the powers with which they've been vested. If you think back to that chart that Grace Marie showed, it's an extraordinary bill in that sense, and it's not well understood. The oversight process is a great way to educate about that. It's also a great way to educate about the difference between promise, which is what the legislation does, and process, which is all those lines on the chart. How do you get to the promise to cover 32 million Americans? What does it really take? And what are the costs incurred? What are the unintended consequences that are underappreciated? People saw the bill, they saw the promises, they might look good, but if they understand what they have to give up to get there, I think it's a very different calculation. Oversight is crucial for that. And there's some things that I think jump out, and there are about 5 of them I want to mention, and then we can take questions. First is, I think it's worth having a good discussion about the high-risk pools. Republicans, myself in particular, have proposed various variants of high-risk pools in the past as a key component of healthcare reform. This bill set up high-risk pools that are performing miserably. And I think it's worth a lot of attention being paid to what were the design problems in those high-risk pools, what decisions were made in implementation, who made them, what can we learn about the failed high-risk pool episode in the Affordable Care Act. And there's a longer list of questions in the paper we wrote, but I think that's something we really want to look at. Second is the Class Act. The Class Act is, it's a budget gimmick of the most barefaced type, but it is also something that I think is very important to study before it becomes the law. As quickly as possible, we should understand what a social insurance program will look like in the years to come. This is one that hasn't started yet. We have no deep commitment to it and shouldn't. It's deeply flawed in its structure. It has bad adverse selection problems. It is going to end up being enormously expensive. It's going to damage private markets. Oversight on who will run the Class Act, what criteria they will apply to setting it up, would be a great educational opportunity on the difference between social insurance markets and effective private insurance markets, which is where we need to end up, but not where we're going. And I think that's worth some time. Third one, I'll just mention briefly, Medicare Advantage. The consequences of the Medicare Advantage cutbacks, I think, are very important, and we need to have a very clear understanding of what's going on here. We've seen some newspaper reports that say this is relatively benign. There was one today. I don't concur with that. I think good oversight hearings can educate the American people about what we've done on the choices of seniors in the Medicare program by scaling back Medicare Advantage. Then I want to talk about the exchange subsidies from a different point of view. It is my deep belief, and this is driven by talking to some people who are closely involved in the setting up of the health insurance tax credit under the Alternative Trade Adjustment Assistance Act. This is back in the early 2000s. This was it was a tax credit to buy health insurance for people who are on TAA. It was advanceable, meaning you got it upfront, refundable, meaning if you had no liability, you still got the tax credit, you got the cash up front, you went and bought health insurance. It took about 2.5 years to set up. It was a tiny population. People who are on trade adjustment assistance have raised their hand. They're a union, they're a factory, they're easily identified, they are begging for the assistance. It took 2.5 years to figure out how to get them the money and the right amount of money in real time, and there was very little take-up of it. And it turned out to be an extremely cumbersome and difficult program. The promise in this bill is that out of 300 million Americans, we will identify every month those who are deserving of subsidies. We will calculate correctly the subsidy they deserve. We will deliver in advance of the due date for their insurance premium payment the right amount to the insurance company they've chosen on the exchange in the state of their current location, and Americans move a lot. I don't believe that's going to happen. And I don't believe that if you called HHS and the US Treasury up today and put them in front of a congressional committee, they could answer honestly, yes, we can do that. And I think when Americans understand the compromises they'll have to make in terms of reporting, information, compliance to make this have even a moderately successful delivery rate, they'll be outraged. And this needs to be better explored and better understood. It's something that is sort of part of there's that old New Yorker cartoon where there's an equation that starts here and then a proof over here, and in between a miracle occurs. That's the miracle in this bill. It's not going to happen. And I think that needs to be explored very carefully. Then the last piece, which is related to the subsidies, is the notion of employer drop and the consequences of that. I think the potential for employers to drop their coverage under this bill is much larger than it has appeared in the official estimates. I think it would be a useful topic for an oversight hearing to understand how one might go about thinking about employer drop and why the estimate seems so low. It's also useful in light of the fact that we have new information now. We have lots of employers have laid their cards on the table about the potential to drop. Updating the budgetary outlook for that I think would be useful. But on top of that, in the threat of drop, we've seen some waivers. I mean, the mini-med plans and their special treatment under the medical loss ratio regulations stand out as the poster child of this. How did that get done? What was the process by which waivers were delivered? Which firms got a competitive advantage by obtaining a waiver and their competitors didn't? I mean, we have no idea how this bill is being implemented at this point, and that's the nature of oversight, to understand better the kinds of consequences of implementing a bill that Congress has written. So I want to thank you for letting me share. I feel better. I want to suggest that there's a lots that can be done to reshape the future. So for the grieving, you always must provide hope, and I now feel better. Thank you very much.